everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Mometasone, and we're going to discuss its nasal spray. Its brand name is Nasonex. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. So Mometasone is a corticosteroid with anti-inflammatory, antipyretic, and vasoconstrictive properties. Although its exact mechanism of action for anti-inflammatory properties is not completely understood, corticosteroids in general have a wide range of activity on different cell types and mediators involved in inflammation. In terms of indications for use, Nasonex or Mometasone is indicated to be used in the treatment of allergic rhinitis. It can be used prophylactically to prevent seasonal allergic rhinitis. It can be used to treat nasal congestion associated with seasonal allergic rhinitis. And it can also be used to treat nasal polyps as well. Now before somebody was to use Mometasone nasal spray, there's a contraindication that they must clear, which in this case would just be a hypersensitivity to Mometasone or any other component of the product. There's also a couple precautions and warnings that they should be made aware of. Because nasal septum perforation may occur with the use of Nasonex, monitoring is recommended for long-term use patients. It should be noted that wound healing may be impaired with the use of this medication. This may be important to patients who have nasal septum ulcers, patients undergoing nasal surgery, or patients who have nasal trauma. And finally, Candida albicans infection of the nose may occur with the use of this medication. Interruption of the medication may be necessary, or even discontinuation of the medication altogether. And once somebody has cleared the contraindication and is made aware of the precautions and warnings, and they start to use Nasonex, as we mentioned, it's available as a nasal spray. If somebody is using this medication to treat seasonal or perennial allergic rhinitis, they would typically use 2 sprays, each spray being 50 micrograms, in each nostril once daily. So the total daily dose here would be 200 micrograms. When treating nasal polyps, a patient may use 2 sprays in each nostril twice daily instead of once daily this time. However, some patients may respond to the once daily dosing. For prophylactic treatment or preventative treatment of seasonal allergic rhinitis, they would go back to using 2 sprays in each nostril once daily, but this time they would start using the medication 2 to 4 weeks before allergy season begins. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Mometasone or Nasonex, so I'll go over some of those here now. We mentioned the possibility of a Candida albicans infection. Some patients may experience a headache. Up to 7% of patients using the intranasal spray may experience a cough. Some patients may experience upper respiratory infections. Now, a more rare but serious side effect would be bronchospasm. That's all we're going to talk about today with Mometasone or Nasonex. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.